We have a question from Jacopo, who says they're from Seattle, Washington. What's going on? Jacopo says, I noticed that hyperacusis with pain tends to get better over time. It's been 6 months, as long as they're not exposed to too many loud sounds. They're afraid that TRT might worsen things. I'm assuming that when you say TRT, you're referring to the sound therapy part of it, because it's worth mentioning that TRT involves high quality education on tinnitus, the sound therapy component, and professional counseling from someone who's trained in TRT counseling. There's some confusion where people think that sound therapy itself is TRT, or people think that hearing aids for sound therapy is TRT. I believe that you're getting a good education on tinnitus if you're watching a lot of my YouTube videos. I don't know if you have professional counseling about the TRT retraining. And if you're following the principle of sound enrichment, then that means you are definitely following the sound therapy aspect of TRT. All right. To answer your question here, hyperacusis does get better over time. There's two types of hyperacusis. One is that it's reactive to loud sounds, and that causes a sensitivity similar to if I have a migraine and there's a bright light, then I'll be sensitive to that light. It's not that the structure of my eyes are behaving abnormally. It's actually that the neurological brain reaction to the light is too much and it's sensitive. Well, in a similar domain, hyperacusis is sensitivity to sound. So the main type of hyperacusis is sounds are too loud. I start to move away. I start to feel that I can't take it and that it's irritating and that it's too loud. And what previously was loud but okay is now too loud, uncomfortable, too much. The less common type of hyperacusis is pain hyperacusis, where it feels as if there's ear pain or that I have an ear infection or there's something inside the ear canal or in the ear that's causing some sharp pain. I'm more familiar with the loudness hyperacusis. That's more in the audiologist domain to help with. The pain hyperacusis, that's typically the ENT, the ear, nose, throat doctor. That's in their domain to try to manage and treat and potentially solve that problem, find a solution for that. TRT won't worsen things, right? If you're someone who truly has reactive tinnitus, where every time you're hearing sound therapy, it's painful, then it wouldn't make logical sense to make that part of your daily routine. For the majority of patients who have hyperacusis, the sound enrichment aspect is highly recommended. Also, for hyperacusis, do not wear earplugs 24/7 or restrict your hearing, making you hear less and less of the environment, because that can have inadvertently negative effects. Thank you for this question.